So in this video, we are going to cover two dermatology questions which were university exam questions. First one is 4 causes for the bullous lesions and the second one is 4 complications of the syphilis. Hello dear students, myself Dr. Maddineni Srinivas. So whenever you are asked such question, if you can answer appropriately, you are going to get full marks. Okay, so this is a scoring question. So let us begin our discussion. Very quickly we are going to see in 2 or 3 minutes. Okay, so whenever you are asked such question, try to classify it and then try to write the answer. The examiner feels good and also you can easily remember till the exams and also even after that. So in the bullous lesions, remember autoimmune causes very important, which are vesiculobullous disorders, pemphigus vulgaris, bullous pemphigoid. If you can write these two names under this autoimmune, it's very good. Next, in the infectious disease, remember staphylococcal scarlet skin syndrome and also varicella zoster virus, which can produce the chicken pox, and impetigo, bullous impetigo, which is due to the bacteria. In the genetic, you can just remember the epidermolysis bullosa. And in the physical and trauma related causes, you can write down the burns, friction blisters and sunburn or cold injury frostbite. So if you write like this and under the classification, the examiner also will feel very happy. Next, what are the 4 complications of the syphilis? So syphilis, I hope all of you know, it is due to the Treponema pallidum. So there are going to be neurological complications. So when will the complications occur? When the patient does not take appropriate treatment with injection rather than penicillin. Okay, so in such cases patients may go land into neurosyphilis. You can remember there can be general paresis of insane, tapes dorsalis. These are some names. If you write them, the examiner will give you full marks. Okay, cardiovascular complications could be CVS related aortitis, syphilis aortitis, aortic aneurysm can happen, coronary artery ostial stenosis. So these are some of the complications related to CVS. So what are the complications of skin and the musculoskeletal systems? So in the skin, you can remember there will be a special type of syphilis called as gummatous syphilis, where there will be tumor like growths. Okay, just remember gummatous syphilis, and also remember there will be Charcot joint. This is very important, which is a neuropathic arthropathy. Patient basically does not feel any sensation, because of which there is going to be joint destruction. Next, third year knowledge. So ocular and auditory complications can also occur. So ocular syphilis patients can have even retinitis. Otosyphilis, there can be sensory neural hearing loss. And also remember congenital complications in your gynecology also. You might have read this. So there can be stillbirth, neonatal birth. There can be early congenital syphilis in which the children, the neonate, can have the hepatosplenomegaly. There can be anemia and jaundice due to hemolysis. And in the late, I hope all of you do remember this, Hutchinson's triad, Hutchinson's teeth, sensory neural hearing loss, interstitial keratitis. Okay, so just write the headings, that will be sufficient. And what are the other complications? Increased susceptibility to the HIV infection and also pregnancy complications, miscarriage. I hope all of you know we are going to do the investigation to rule out the syphilis in the pregnant woman. Okay, this is it. Write down and you are going to get full marks. Happy learning. All the very best.